My name's Chris, like Dina said. I'm a SHIP counselor at Good Shepherd Hospital. And even though I work for the hospital and the corporation of Advocate Aurora Health, um, just under the certification of being a SHIP counselor, which we'll talk about later, I'm not here to promote any particular brand or um, advocate for any specific type of insurance or hospital network or anything like that. That's part of the certification you get as a SHIP counselor. So um, I'm hoping today, if you walk away with nothing else, it's just a better understanding of the program as a government federal program and what we can do for you, how we can help, and that we are available. Um, so we'll go ahead right into it. So for today, we're just going to talk about what the SHIP program is, how it started, where it's progressed to at this point, and then we'll talk about what a SHIP counselor is. Just a brief review of Medicare. I know you know what Medicare is. We're just going to kind of touch on some things, and then what can a SHIP counselor do for you? Okay. So the SHIP mission is to empower, educate, and assist Medicare eligible individuals, their families, and caregivers through objective outreach. Again, objective is the key word. Counseling and training to make informed health insurance decisions that optimize access to care and benefits. You'll hear Senior Health Insurance Program as the acronym SHIP Senior Health Insurance Program, or that's interchangeable with State Health Insurance Assistance Program. They refer to the same thing. Okay, so our history. So the Illinois SHIP program began development in 1988, or by the Illinois Department of Insurance in response to the needs of Illinois seniors, just regarding health insurance, regarding what Medicare looked like. Back then, we didn't even have Advantage plans, but still, there was some confusion on understanding uh, what Medicare was, how to go about it, how to apply, what coverage individuals got, how they dealt with just different health situations. SHIP was created under Section 4360 of the Omnibus Budget Reconciliation Act, so that was OBRA of 1990. So this law authorized the Centers of Medicare and Medicaid Services, that's CMS. I may say CMS, and that's what I'm referring to. So if I use that acronym, that's what I'm talking about, to make grants to states to establish and maintain health insurance advisory services for Medicare beneficiaries, just for Medicare beneficiaries. The program was transferred to CMS from CMS to the Administration of Community Living, ACL, in 2014. And then nationally, under ACL, there are 54 SHIP guarantees. So all states, Puerto Rico, Guam, District of Columbia, and the U.S. Virgin Islands. Maybe I can ask to be transferred to the U.S. Virgin Islands. Nationally, 2/3 of SHIP programs are housed under the state departments of aging and the others under state departments of insurance. Just a little idea of how that all progressed. Roughly 4.3 million Medicare beneficiaries, family members, and caregivers received SHIP services in 2022. That was the last time we had that data available. So as of then, and it's only increased since then. Of these, more than one-third receive direct one-on-one counseling, most in person or over the phone. I do most of my work with individuals, with beneficiaries, with patients in person, typically one-on-one, or with couples or with families. Um, so most of my interactions are in person. Um, ACL and CMS work with SHIP. So ACL provides federal funding, oversight, and administrator grants to each state SHIP program, as well as other programs for older adults, people with disabilities, and families and caregivers. So CMS administers and manages the care services for Medicare, Medicaid, and the health insurance exchanges. So that's the distinguishing factor on how they interact with our program. Federal funding for the State Health Insurance Assistance Program goes to the U.S. Department of Health and Human Services, so HHS, another acronym. Sorry, we've got so many. The funds are then allocated to 54 state and territorial programs via population-based grants. Money pays for program operations, technology, data management, and the physical infrastructure required to operate the counseling services. So it's not just, money flying out the door. We have different programs that SHIP counselors have to attend regularly. We have to be in the know of what's going on. We have to complete paperwork for the state just on what we're doing and keep everyone up to date with how many meetings we're having regularly, just so that the federal government can understand, oh, this program is still necessary, it's still something that's ongoing and needed. And they do that by seeing the numbers. Numbers don't lie. So, and we do that all through different sites, different forms on different websites. So that's all maintained with the funding. Funds are also used to train, test, and certify both paid, staff and volunteers who provide in-depth help with Medicare, Medicaid, and supplemental insurance. Many of the SHIP counselors you may deal with are volunteers. What's nice about that is people who volunteer are typically retired, and they kind of have an understanding of how people are feeling in certain situations, whether that's just signing on for Medicare or dealing with an appeal to Medicare or figuring out different plans they can go with, or what they need to do if they're moving states, or all these different situations. Everything is circumstantial with how we deal with all the beneficiaries or patients that we deal with. I'm paid by Advocate Aurora, so I'm paid by Good Shepherd Hospital, but again, under my certification, I'm not allowed to promote anyone. That's a weird place to be in between, but it's worked, and I'm just here to help people. That's what I'm here to do, first and foremost. So you can see how the funding's it's pretty much stayed solid for the last couple years. We've maintained, that amount of funding and been able to work with that for a good long time. The trouble is, Medicare's become more and more complex. You have more and more people in different situations. So, you know, just us keeping up with that is tough with our funding, but we've made it, and we're going to continue to make it. Obviously, we're here to help people. Again, first and foremost, that's our job. Um, so funding is distributed to states and territories using specific statutory formulas. So that's all figured out by, people who do statistics and who are much, much smarter than me. A fixed base amount for each state, about 75,000 for states and 25,000 for smaller territories is distributed. States often supplement these with federal grants. These federal grants with their own state-specific funding or just donations. So this is going to sound real tiny, but federal funding for the SHIP program equates to roughly $1 per Medicare beneficiary annually. Now that's changing because our funding's staying the same, but situations are changing. But two, we are getting more SHIP volunteers, we're getting more awareness for the program, and we're getting out into more um, places so that people are finding us available. So um, that's kind of how that's gone so far. Um, Now, the breakdown of who we are in the program isn't too complicated. Most of who you're dealing with are counselors. So it starts the head of the totem pole there is the Illinois Department of Aging, which provides the initial training, continuing education, and support for the SHIP counselors. So the initial training is it's a couple classes that you have to go through, and then they have to pay their trainers. Those trainers all work through the Illinois Department on Aging. The SHIP sponsoring organization or SHIP sites aren't really they're not really a piece in the totem pole, but they're just important. They're more adjacent to the totem pole. So Advocate Good Shepherd Hospital would be one example. Door County has their own SHIP counselor, so that's a SHIP sponsored site or organization. They provide coordinators with office space and office supplies. The SHIP coordinator is responsible for the administrative aspects of the SHIP program, which includes publicizing SHIP services, recruiting volunteers, scheduling counseling sessions, and just responding to counselors. So they're kind of the middleman between the Illinois Department on Aging and the counselors as individuals. Coordinators are usually the head of their particular site. So if you were to become a volunteer, a SHIP volunteer, you'd have to go under a coordinator. For Good Shepherd Hospital, I'm the coordinator, but I only work with one other counselor, so I'm not really in charge of anything. She's much smarter than me. So there's the coordinators and then the SHIP counselors, who you'll more likely than not be dealing with. SHIP counselors meet with clients individually to provide uh, objective information about health insurance, advocacy assistance, and referrals. So we're kind of the main point of contact. Any coordinators are typically counselors as well, so they're kind of the same job. So there's only 4 divisions in Illinois. It's divided geographically into Cook County, Northern Illinois, which is where I'm at Good Shepherd Hospital, Central Illinois, and Southern Illinois. So the role of a counselor. The SHIP counselor is a person who objectively counsels Medicare beneficiaries, their caregivers, or representatives who have problems and or questions with Medicare, supplements, managed care, or other insurance related questions. The last time I did a presentation for Elderwerks, I actually made a mistake, so I want to correct that now. Someone had asked if MMAI was still around in um, in concern with this particular slide, which is managed care. Um, MMAI is no longer around, so I apologize for messing that up. If you have questions about that, we can talk about that after. So other responsibilities of a SHIP counselor include just providing free, we're always free, unbiased, localized counseling to Medicare beneficiaries. Even working in the hospital, my services are free. I don't charge. You must satisfactorily complete the initial SHIP training sessions and pass the certification exam. Like most certifications, even becoming a realtor or getting a CPR certification. You must counsel clients through the SHIP sponsoring agency, conduct individual health insurance counseling sessions, affording complete confidentiality to the client. It's not like it's in that regard, it's like seeing a doctor. It's like the HIPAA laws. You don't just talk about everybody else with whomever. So your secrets are all safe with us. Um, we also assist with Medicare uh, that was supposed to be Medicare and Medicaid appeals claim filing. So I'm sorry for messing that up, but we also serve as advocate for SHIP clients. Additionally, we provide counseling without conflict of interest. We cannot be affiliated with any insurance industry or insurance claim filing businesses to the extent that serving as a SHIP volunteer could be used for personal and financial gain. So again, the objectivity of this role cannot be overstated. This is a very non-biased position that any SHIP counselor, whether they're a volunteer or a paid staff member, is in. We cannot recommend a specific insurance company, agency, or policy. I have given out independent agents and brokers in the area, but only as a as options. I certainly do not recommend any particular one. It's just whomever I've been told about by different patients or beneficiaries that are local and available to people. So I'll give you the list. That's about it. We have to attend ongoing education programs. So for counselors, it's a quarterly check-in, and then we do an annual conference. And it's not, something we put on at McCormick Place. It's just us getting together and understanding what changes are coming in the following year. So we kind of have an understanding of what to expect, what we can advise people on, different medications, what to look out for, and what different insurances are covering and not covering. We talk to community groups about SHIP or information pertinent to senior health insurance issues at our own discretion. And we must agree to a background check. So I got fingerprinted, all that stuff. So you can you can rest assured that I'm not some criminal. Um, SHIP currently has 300 offices throughout the state of Illinois, staffed by a total of over 900 certified counselors, volunteers, and paid staff. All offices are supported by local sponsoring organizations that offer services to Medicare beneficiaries. SHIP also provides a toll-free line, which I'll have information on towards the end. Um, And SHIP activities align with the Illinois Department on Aging's mission to help older individuals maintain their health and independence while remaining in their homes and communities. We don't just help the older adults, we also help the caregivers. There are many resources available to assist you in your caregiving role. I've dealt a lot with people who are helping mom and dad at different ages. I've had a lot of people who are helping a child who is disabled and who has been on disability for 24 months, 2 years, and therefore qualified for Medicare. So I've helped with that. Just getting into different programs to make sure that everybody's taken care of and their healthcare is well managed. AARP has compiled family caregiving guides available through Illinois Department of Aging and SHIP counselors to serve as a practical tool to help you get organized, determine needs and resources, create your caregiving plan, and find support. I think if any role in the family, in a family unit, has been underappreciated, it's caregivers. I think the unsung hero of the families with not just um, people who are sick, but people who are older, just in situations where they need to become a caregiver. It's um, something we don't have enough resources on, but certainly that SHIP has more resources than I think most other programs. So this is a helpful little directory if you go online at all. If you go to shiphelp.org, you can find a directory of different SHIP sites available to us locally. We're nationwide, so if you go to shiphelp.org, you'll see Find Local Medicare Help. You'll see the button up in the corner. You don't have to have a login or anything. Click the button, and then you'll come up with this screen, and then you'll just say what state you're in. You'll get a list of different counties, and you'll go by county of all the different sites within your county. So, great for people who you know in different states who need help and don't know where to look. This is a great resource for that, just to try and find them help. Of course, it's something I reference often enough, so I'm able to look up people as well. Oh, sorry, I think we're froze here. Okay. Sorry about that. I'm not sure why I froze. So this is the SHIP contact line for Illinois. So you can email or call toll free. So aging.ship@illinois.gov. You can just send them an email or you could call the 1-800 number. You could send them mail as well, but they're out of Springfield. Okay, so we're gonna real briefly kind of cover some things on Medicare so that we can address how SHIP interconnects with that and how we can help on these different topics. Um, so, Medicare is a federal government program that offers health insurance to those 65 and older or under 65 disabled and on Social Security for 24 months, 2 years. Any age with end-stage renal disease or ALS, U.S. citizens or permanent legal residents to the United States for a minimum of 5 years in a row, including 5 years just before applying to Medicare. Medicare is managed by the Centers of Medicare and Medicaid Services and began in 1965, meaning Medicare is not 65 years old and therefore cannot apply to itself. Over 94% of people age 65 and older in the US are enrolled in Medicare. The remaining percentage are individuals who are they're still working and maybe have their employee group health coverage or have a spouse who has the employee group health coverage that they're covered under, and they've chosen to delay enrollment while remaining covered through their employer-sponsored health plans or those receiving equivalent benefits through other federal systems like VA. All right, so since 1985, a growing share of those ages 65 and older have continued to work full-time or part-time because of personal preference or economic necessity. In 2024, 19.5% of people aged 65 and older continued to work according to the Bureau of Labor Statistics. And as of 2026, that number has jumped to 22%. Um, it's not necessarily always a bad thing. Sometimes people just don't want to retire and they're happy where they work or they're happy doing what they do, or and of course, sometimes it is a situation where they're having to continue to work because of whatever life situation they're in. Um, so circumstantial again, but some interesting statistics on those 65 and older continuing to work. So, Medicare beneficiaries in the US, more than 68 million Americans are currently enrolled in Medicare. So 90% of that, of course, is 65 and older. But the remaining 10% is younger individuals who have the qualifying disabilities. 10% is pretty small in comparison to the full 90% there. There's no one size fits all for Medicare. I say that to anyone new to Medicare when I do presentations at libraries and park districts on Medicare. I always say that. I say if they walk away with anything else, they should understand that there's no one size fits all for Medicare. Just kind of a review on how things look now and how everything is structured with our alphabet soup of Medicare, A, B, C, D. So Social Security Administration processes your application for Part A and B. So that's where we always start is A and B. Once processed, you select a coverage plan. So you can either go down the right column or the left column. So the first column, the left column, original Medicare, that is how things worked for a long time. It wasn't until the 2000s that the Advantage plans came into play and kind of changed the game. So we always started with A and B and then had a supplement. So that's how original Medicare still looks. You have your A and your B. You also add a Part D for drugs, D for drugs, and then you add your supplement. A and B are the portion of the puzzle that are administered by the federal government. So that's the portion where we get this little card, the red and blue card. The rest, whether it's D or your supplement, are supplied by a private insurer. So Blue Cross, Aetna, Humana, United Healthcare. Those are the sources we get our other pieces of the puzzle from. Anything outside of A and B is distributed by a private insurer, whether you go original or Advantage. The alternative to original is Advantage, of course, which is the bundled plan, where everything's all put together. You have your Part D drug coverage, usually vision and dental included. the disadvantage to having an advantage plan is, of course, the fact that it works a lot like how we have things with employee group health coverage, where you have your PPOs and your HMOs, and you may get denied a claim here and there. They may not cover certain things or fully cover certain things. So, despite the fact that we're paying less on a monthly basis in premiums, we still may owe more later in terms of whatever health situation we find ourselves in. A major diagnosis, a major accident. In those situations, we may owe more out of pocket, even for things like going to the doctor on a regular basis. The disadvantage to original Medicare, you are paying a lot more upfront. So you're paying for all the what ifs. This is kind of the difference we explain to people as they're first signing on, because you're hearing all these different things from, your neighbor Jan or your coworker Dan. Um, you're hearing all these things and you have no clarity on where to go. Um, so I like to call original Medicare the buffet plan because you pick and choose what you want, you make a full plate, as opposed to the Advantage plan, which is the meal deal. It's your number one on the value menu. You get your fries, your drink, and your burger all together. Um, that's kind of the difference between the two routes we have. Ask not what Medicare can do for you. Ask what your SHIP counselor can do for you. That was a little JFK. I'm not going to do the accent because I do a terrible job. So SHIP counseling for you, there's a lot we can do for you. So of course, new to Medicare, we, need to kind of make a game plan for people if they're going to continue to work, if they're not going to continue to work. We make that plan together as counselors with people. We kind of give quotes on supplements, so we give options on what's out there for them, what possibilities they can go with, whether that's supplement or advantage plan. We can help you sign up for A and B. We can sign you up for an advantage plan or a Part D. Supplements, they have you go through either an agent, uh, independent broker, or agent, or the company itself to sign up for that. We also help with annual enrollment assistance. So that's a yearly thing that we help people on. I'll kind of talk about that a little bit more in just a minute. We help with Medicare claims and appeals. We help you understand your beneficiary rights and guarantees, physician and hospital bills, including supplement insurance claims, and then assistance and referrals to available senior programs and discounts. Um, so, annual enrollment that I had just kind of mentioned. It happens every year from October 15th to December 7th. During that window of time, you can review or change either your Part D or your Advantage plan. You can meet with a SHIP counselor for help on that. So we have that window of time every year to change you out of the plan you're in currently. Typically, what happens is your insurance plan will send you what they call an annual notice of change around September. If you're seeing anything you don't like, that's the time you can decide, okay, I'm going to change from Humana Part D drug coverage to WellCare. So you can make an appointment with a SHIP counselor, um, usually as early as possible. So certainly for me, I have people making appointments a year in advance. just to meet and review what they're looking at and just to see if I've been notified of any changes with specific medications. Of course, this year the hot button issues are the Wegovy and kind of the A1C drugs, right? Um, so we talk a lot about that with Part D coverage and Advantage plan coverage. For your Medigap or supplement and Medigap are interchangeable words. You can apply to change your supplement at any time of the year. Unlike Medicare Advantage or Part D, there is not a set annual enrollment period. However, the trouble with those plans is they may do medical underwriting if you try to go from, say, Blue Cross to Mutual of Omaha. You may experience medical underwriting where they look at your medical history and they can decide whether or not to take you take you and maybe charge you more if you look like too big a risk or deny coverage. So that's a discussion you can have individually with a SHIP counselor. Um, we can help with that. We can give you quotes on different plans, and just take a look together on what your options are. So just important thing to keep in mind, know that every year you can change your Part D or your Advantage plan, and we can do that together. Not necessarily me, but SHIP counselor you may know or local to you, and consider your options. Also, so with appeals, for original Medicare beneficiaries and providers, appeal less than 1% to 6.4% of denied or prior authorized claims, often because the process is just daunting and frustrating and annoying. The success rate for appealants have strong odds. More than 80% of appeal denials are overturned, which are with cases frequently won due to new documentation being provided and just what the healthcare professional can give to the insurance company. With Advantage plans, the appeal rate's a little higher, roughly 11% to 12%, and over 80% again of these appeal denials result in the insurer overturning their initial decision and improving the care or payment. So I do work a lot with appeals, and I will say I have rarely experienced, if ever experienced it, where a claim is completely denied. Sometimes it takes a couple tries where we have to appeal a couple times. I've had that happen, not more than 2 times. So sometimes it happens where we have to appeal a couple times. That's something we can do together, depending on the situation, and try and get you covered.